In this video, I'm going to cover the topic of nerve flossing and if it is an effective treatment tool or a waste of time. I'll cover the following: the true definition of a treatment, what causes nerve entrapments to occur in the first place, what nerve flossing is nerve flossing effective, and lastly, how to effectively find and treat nerve entrapments. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. I'm also the creator of the Peak Method and the founder of the Soft Tissue Treatment Revolution, where we teach overworked massage therapists a better treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid that dreaded burnout, and help a hell of a lot more people get out of pain. All right, let's get into the educational video this week. Nerve flossing, effective treatment or a waste of time? So I just always want to start off every video kind of giving like a context of how I look at things. And I want to start again with what is a treatment? A treatment is some form of an intervention that aims to remove some form of a pathology that is also safe, effective, and durable. I talk about this all the time. There's only 7 problems in the human body that we would treat as musculoskeletal providers. It's going to be a bone problem, a cartilage problem, a disc problem, a ligament problem, a nerve problem, soft tissue problem, or a tendon problem. And as far as safe is, does it do any harm to the client? Effective, does it produce some type of functional change, maybe symptoms as well? And lastly, durable, is it long lasting? So we always want to have that in mind when we're trying to decide, is what I'm doing an actual treatment, or am I just changing something temporarily in the tissue to allow them to feel better in the short term, but we're not improving anything functionally? So just wanted you to kind of have the breakdown of that so you get an idea to understand if nerve flossing is a treatment or not. So, I want to start with just the idea of nerve entrapments. They're really important. I actually have a whole video series that I did on YouTube that I'll link up top here. If you're watching it on YouTube, I'll also put it down below in the description if you're watching this anywhere else, where I go through all the upper extremity nerve entrapments, really get into the clinical signs, palpation, treatment, all that. Really a lot of knowledge, but nerve entrapments are a big deal, and they're often missed by a majority of practitioners. So, why do they form in the first place? So basically what happens over time is muscles, fascia, ligaments, they get overworked. They don't get enough blood flow. They don't get enough oxygen. Could be from an injury, could be from bad posture, sustained contraction, all that stuff. And they eventually start to develop this stuff called scar tissue. Scar tissue is basically just like immature collagen fibers that go into the muscle that are in response to it getting overworked. It's like glue that gets inside there. Then eventually that scar tissue gets bigger and bigger, and eventually it gets stuck to the nerve. The nerves are built with about 15% of extra slack to keep them healthy. Over time, those nerves get caught. And when they do get caught, they present with some clinical signs of numbness, burning, tension, and pain. And a lot of times there's some physical presentations around the nerve entrapments as well. They engage in what's called protective tension, where things are just like really locked down and tight because they're trying to protect that area and not load it, because the body's number one mechanism is always to protect the nervous system. Because if the nervous system doesn't work right, then you don't work right. And I really think this is the most important thing that you have to treat first in any successful musculoskeletal treatment. So that's what a nerve entrapment is. So, what is nerve flossing? I just took this off of Wikipedia. Nerve flossing entails tensioning one end of the nerve while simultaneously releasing tension on the other end. This repetitive motion glides the nerve back and forth through its path and aims to release adhesions that have developed along the way. Sounds good in concept and conceptualization. I can't even say that word right. It sounds good as what it's doing. It's trying to free up that nerve entrapment because they are a big deal and they cause a lot of problems. So let's break down nerve entrapment a little more, kind of get an idea if it's actually a treatment or just producing a temporary effect. Is it safe? Sure, it's safe. You're not really doing any damage to the area. You're not getting in there with a scalpel or doing anything really aggressive with it. You know, some people are way too aggressive when they use their elbow or they beat the hell out of it with an instrument. not as safe, and that creates a lot of breakdown of the tissue, a lot of unnecessary bruising. Effective, sure. It's effective in the short term because anytime you stimulate some of that nerve and loosen it up a tiny bit and give it some wiggle room, it's going to temporarily feel better. Now, is it durable? Durable? Is it long lasting? Is it going to actually hold? No, it's not. It's not a durable treatment because you're actually not making a physical change. When you're just going through and holding it down and then forcing it through there, you're not actually breaking down that nerve entrapment. You're just pulling on it. So, why isn't it a treatment? It's not a treatment because it's not changing one of those pathologies. It's not removing the actual nerve entrapment. And the symptoms, yes, they do temporarily improve. So, why does this happen? So, anytime you do any type of vibration or movement, stretch, massage, an adjustment, anything like that, what it does is it stimulates these things in your spinal cord called mechanoreceptors. They basically sense vibration and movement, and they travel up this pathway in the spinal cord called the lateral spinal thalamic tract. What else travels up there is pain. And when you stimulate and you stretch the nerve or you move it around or you do an exercise on it, it gets those mechanoreceptors really firing. And then they start to fire a lot and it blocks some of those pain receptors. So you don't notice it. So temporarily, it does feel better, but it didn't actually improve the function. So treating these can actually be dangerous. Why is that dangerous? You're like, oh, the client feels better. Sure, it's great. The client feels better. But the problem is you didn't improve anything in the function. So any treatment that only improves symptoms but not function is actually dangerous because say this client does have like a really nasty nerve entrapment somewhere in the subscap or down the chain, you release that and they temporarily feel better, then all of a sudden they think they feel better and they can go do a workout. They go do a heavy overhead workout or they beat the hell out of their shoulder. What happens is that nerve entrapment's still there. It's going to put more pressure everywhere else and it's going to cause bigger problems down the road. Just because you fix symptoms doesn't mean anything. You must also improve function, and that's by breaking down that nerve entrapment effectively. And lastly, low level application skills equal poor long-term results. So a lot of other providers out there, I see this with personal trainers where they think they can fix everything. They're gurus of fixing all these complex musculoskeletal injuries. They like to do a lot of nerve flossing because they don't actually have to like be good with their hands and have that precise feel and that precise feedback of feeling on that nerve. So they do it. Physical therapists love to do this as well because anything they do where they don't have to actually be good at soft tissue treatment and produce a temporary effect, they think it's doing something, but it's actually causing big problems. So, effective treatment of nerve entrapments. First is we always want to start with a thorough and detailed injury history to know what's going on. I always say if you don't know what the problem is, you can't fix it. So many providers, and I did this myself over the years, is I would just go right to where it hurts and just assume that that's the problem and I'd start working there. I wouldn't really collect a lot of data. In my system called the peak method, we really break this down about asking the right questions, knowing exactly what's going on and formulating a hypothesis about what could be possibly happening. Then we go into a functional based testing to identify potential compromised areas where we look at range of motion, we test that nerve and we see where it's at. Then once we find where that restriction is, we go into an advanced palpation of that nerve. When a nerve entrapment occurs, most healthy nerves kind of have like a little wiggle room to them. I call it like a bowing thing where they can bow and move in different directions. When there's a nerve entrapment, that nerve is stuck. It bows. It's very tender to the client. It doesn't move. That's how we know it's there. Now that we've identified it, now we actually need to go in and break that down effectively. Now, when they talked about nerve flossing, they're kind of holding high and then pulling it through. They're not actually generating the thing that needs to be generated. First, what we do is we find it, and then we put the muscle or that area in a shortened position. Then we get proper depth into that nerve entrapment and where it is. Then we set tension into it and it's really loaded up. Then we have the client go through a full range of motion. And as we do that, the entrapment comes to you. There's no actual sliding of your thumbs or your hands as you do that. That's what they teach a lot in like myofascial release or active release technique. You kind of slide as it goes. No, this comes to you as you're applying proper depth and tension. That's what actually breaks that down. Now, when you do the treatments, it's very slow, it's very deliberate, and it's very precise. And you only use your hands. You don't use your elbows, you don't use instruments because it's such a precise and focused type of treatment. If you're using your elbow, you don't get any feedback. You get way too much depth, not enough tension. Instruments usually can't break this down either because you're missing that component of that tension. Then you also just want to be really careful with the dosage of what you do. And I only do about 5 to 7 treatment passes on each area. That's why I teach more of a shorter but more effective treatment system and follow-up treatments that are only about 15 or 20 minutes long because the nerve can only handle so much. If you're doing like an hour and a half, 2 hour long session, you're actually causing more damage, causing more inflammation, and the client isn't actually getting better. You're doing more harm than good. So no, nerve flossing isn't an actual treatment. It temporarily makes it feel better, but it's not actually fixing it. You need to get proper depth, proper tension, and feel that nerve entrapment and that tissue slide. That is what breaks it down. That is what gets long lasting results, and it allows it to be durable. That's why it fits all 3 criteria of an effective treatment. It's safe, effective, and durable. So that's all I got for you guys. You could do me a solid and help spread the material. Share any insights you might have gotten in the comment section below. You can also share this with other providers that you know that it might help. And lastly, you can go in and download our free training modules. We really get you in the idea of thinking critically, becoming a problem solver, doing it better, faster than anyone else out there. Appreciate you guys watching this one, and I'll be sure to see you on the next one. Bye.